Go ahead,
Good
ma'am.
afternoon. Yeah. Good afternoon, everyone. I'm Dr. Poornima Mathur, and as always, this Wednesday we would be discussing something related to fertility topics. Today, we've chosen a very difficult topic, difficult to the patient because it's very disturbing. What do we do after a failed IVF cycle? Like, what are the what happens when? Like, what is the reason? There's so many questions related to it. So, आज हम उन्हीं को थोड़ा सा डिस्कस करेंगे. So, when we have a failed IVF cycle, the first step that comes to our mind is why? Why did it happen? Usually, हम मान के चलते हैं IVF is the last resort fertility treatment, right? And if the last resort does not work, so what next? How do we proceed further? So let me tell you, let us discuss. IVF has a success rate globally. If we say it has a success rate of around 40 to 50%, with added newer techniques, more advanced features, going for a frozen embryo transfer, going a blastocyst transfer, advanced techniques, we would give you a higher success rate. But the success rate would still depend upon the patient particular, like that couple, कि उनकी fertility, उनकी age क्या है, what is their egg reserves, मेल पार्टनर जो है उनको कोई प्रॉब्लम है क्या, what are the sperm के factors, अगर एम्ब्रियोज बनते हैं वो कैसे हैं, कॉज ऑफ इनफर्टिलिटी क्या है. सो देर आर सो मेनी फैक्टर्स दैट वुड डिटरमाइन वेदर हमारा आईवीएफ का सक्सेस रेट कितना होगा. सो I know it is very difficult to deal with an IVF failure, but if we see IVF can be further split into so many steps, starting from the stimulation, egg retrieval, embryo formation, and the final culmination is the embryo transfer. Now we can have a problem almost anywhere of this stage. Like it can be there can be a poor response, there can be a poor quality eggs, poor quality embryos, or the transfer does not work. So here we would be discussing what if there is a failed embryo transfer cycle. So अगर हमें उसमें देखना हो तो क्या क्या factors होते हैं. The first thing is like why did it happen. So when we go and analyze it further कि कौन कौन से factors हैं जो failed embryo transfer करते हैं, तो इनको हम grossly divide कर सकते हैं. One that is related to the maternal factors, that is mother से related, or the embryo से related, or obviously we cannot rule out the father. The father is as important as the mother. So there can be problem with the uterus की formation, the anatomy. There is adenomyosis, fibroids है, endometriosis है, or there is certain blood coagulation disorders like thrombophilia. Now thrombophilia में blood में थोड़े थोड़े से blood clots बनते हैं, which can further like cause blockage of certain arteries, affect the blood flow to the uterus, and further हमारे conception में, or at times pregnancy advance नहीं होने देती. Now, when the baby comes and lives in the uterus, the body should accept it. At times, the body does not accept it, and immunological factors आते हैं, which cause a problem with the pregnancy progression or the pregnancy के लिए implantation of the embryo. And the most important thing is the endometrium. Now, endometrium is the lining inside the uterine cavity. Now, ये जो uterine cavity है, इसमें जो endometrium है, उसकी हमें thickness, उसकी morphology, उसका blood flow, everything has to be studied in detail, even the volume of the endometrium. So, if there's any problem over there, that can lead to a failed cycle. Apart from that, हमारे embryo के features आते हैं. Now, कई बार now the embryo के अंदर there should be a genetic potential in the embryo to develop further कि वो हमें एक live pregnancy दे सके. Now, if there is some genetic problem with the embryos, the embryo जो है हमारा शायद आगे progress होने में उसे problem हो. That is the embryonic factor. Or else जो एम्ब्रियो हमारी थिक उसमें होता है, अगर हमारी जो आउटर लेयर होती है एम्ब्रियो जिसमें होता है, अगर वो बहुत थिक है कि एम्ब्रियो हैच नहीं हो पाए, और जो एम्ब्रियो है वो डे 5 तक कल्चर नहीं हो पाता, these all lead to a failed cycle. And of course there is male factor कि अगर स्पर्म्स की क्वालिटी बहुत खराब है, मेडिकल कोमोबिलिटीज है मेल को, हाई अनकंट्रोल्ड डायबिटीज or other medical disorder which affect the quality of the sperm, that can lead to a poor result in the IVF cycle. So IVF cycle जब हमारी fail होती है, it's very disheartening. We feel कि how do we proceed further and how to progress further and how do we do. So we at Oasis believe in we that we use newer techniques advanced technologies in order to increase the chances of you getting a positive outcome in your IVF cycles. So whenever there is a failed cycle, how do we proceed further to enhance कि हमारे आगे subsequent pregnancy में हमारे chances, subsequent IVF trial में हमारे chances of getting pregnant are increased. So the first and foremost thing that we would like to see is कि when do we start? हम कब वापस start करें? Why? When do I go and consult my fertility specialist? One is you go and meet your doctor again. We will see you. First thing is having a detailed discussion regarding why did it not work that time. That involves आपके previous सारे records की analysis, including आपको injections क्या मिले थे, आपकी eggs की quality कैसी थी, how were the embryos formed, embryos का culture कैसा था, उनकी growth कैसी थी, morphology कैसी थी, is there any associated medical comorbidity आपके उसमें, how was the endometrium when the transfer was decided, vascularity कैसी थी, and ये सब कुछ. Ideally, अगर आप बोलोगे कि when do I start again, we would say anywhere between 4 to 6 weeks would be a gap that is needed between you starting again. It would depend upon your particular case, जिसमें हम देख के आपको बता सकते हैं whether we need any further or time चाहिए क्या. Now, why do we need this gap? Why can I not start immediately? Because it happens. अगर work नहीं करता हमें लगता है कि चलो let's start again and let's give it full go. But we would be needing a gap so that your body can heal both emotionally and physically. If there is any inflammation or anything that prevented us from getting pregnant in the first time, that needs to be healed and taken care of before we can start with the next attempt. The main thing is we do not repeat the same thing again. We have to learn from our mistakes. So if in case one thing did not work well, we have to introspect, see where can we make some changes, what newer techniques can be added to it so as to maximize your chances of conception. Going through the same thing again, अगर हम वही चीज which did not work out for us हम वही हम दोबारा करेंगे, that does not make sense. So we actually offer higher facilities and higher technology so that it can maximize your outcome potential. The next would be कि क्या कर सकते हैं मैं after studying your previous IVF records. कि what can be done differently. We choose the stimulation has to be changed अगर number of eggs कम थे या ovarian reserve कम है, injections, quality of eggs and उनके लिए सब changes लाके we would like to evaluate further. The uterine anatomy. Now we've seen कि अच्छा uterus in the maternal factors, the uterus plays an important role. So how do we know whether the uterus is fine or not? So if there is any anatomical कोई problem है, say for instance fibroids है, adenomyosis है, or any polyps है, so that can be assessed. It can be detected on a 3D ultrasound, which is done on an OPD setting by your gynec yourself, and then we can go ahead with an hysteroscopy. Now, what is hysteroscopy? Hysteroscopy may we put in a camera inside your uterine cavity and we visualize the cavity. उससे हमें पता चलता है how is your endometrium, वहाँ पर कोई septum है क्या, how is the blood flow, क्या कोई evidence of any inflammation या infection है, कोई flimsy adhesions है. So once we get a detailed understanding of the endometrium, we can take the necessary interventions. For instance, if there is any suspected inflammation, हमें endometritis लग रहा है कि infection हो सकता है, that is treated accordingly. In an Indian setup, we can never rule out TB. मतलब TB we consider it to be a disease of the underprivileged, but TB is very prevalent in our country, which is not studied by the Western countries. So we can have an endometrial biopsy to study for TB PCR. Now SOS laparoscopy. Now why do we need a laparoscopy? At times जो हमारी tubes होती हैं, they can be distended. जो हमारी fallopian tubes हैं uterus के पास में, उनमें inflammatory fluids हो सकता है. That is called a hydrosalpinx or a pyosalpinx. Now ये tubes में से अगर ये inflammatory fluid comes into your endometrial cavity, वो आपके embryo के implantation के chances को significantly कम कर देता है. So if in case on a 3D ultrasound we suspect that there is a hydrosalpinx or a pyosalpinx, you would be benefited from a laparoscopy where we can clip these tubes or remove them instead, so that ये हमारा inflammatory fluid does not interfere with your implantation. Similarly, we have thrombophilias जो हमने डिस्कस किया था, एक ब्लड जमने वाली डिजीज है जिसमें ब्लड जम जाता है, अलग अलग वेसल्स को ब्लॉक करता है. So this can lead to both recurrent IVF failures as well and recurrent pregnancy loss as well. Apart from this, ये बहुत सारे medical conditions भी cause करता है, for instance cardiac attack or stroke and ये सब. So if in case you evaluated and you're suspected, तो accordingly आपका management चलता है, which includes certain medicines and injections to manage it further. Then we have seen कि immunological factors भी होते हैं. Immunological factors if the body is not accepting हमारे embryo को, consider this as foreign. So how do we evaluate it further? So there are many cells, many blood, many tests available. जैसे uterine NK cells होता है हमारा, where we have a T cell cross match होता है हमारा. So how do we overcome it if we have found it seems to be an immunological factor? So we have treatments for that. It would involve या तो immunoglobulins हम दे सकते हैं. Immunoglobulins can be given at the time of transfer, after the conception. There is intralipids. Now this is a more advanced version which is done at all the Oasis centers, especially ours does it. So these immunoglobulins and intralipids, they help you overcome the immunological factors so as to ensure a pregnancy. Now, the most important thing that we say to you when a transfer is happening, we're more worried about the endometrium. So the endometrium, how do we assess that? Now जो endometrium जो होता है जब हम ट्रांसफर करते हैं embryo, it has to be very synchronized. There is a very detailed interplay of hormones happening at the level of endometrium, where the hormones and the genetic factors, everything is coming into an action. So now when a transfer fails, when there has been a detailed analysis where the embryo quality seems to be fine, at times we have it like everything seems to be perfect in our case. The embryo was good, it was a day 5 embryo, and the lining seems to be developed very well. उसका blood flow अच्छा था. Now in the endometrium you will be studying the thickness, the morphology, the blood flow, the movements of the endometrium, the volume of the endometrium. Now everything is fine and yet it does not work. So there is a window of implantation, जिसको हम receptivity window भी कहते हैं. The endometrium is not always ready to accept an embryo. There is a small window that is an interplay of hormones कि when the progesterone comes into your body, उसके इतने hours के बाद, for इतने hours the endometrium is receptive to accept any embryo. Now this receptivity window can be detected by an ERA test, that is the endometrial receptivity assay. Now how does it happen is कि आपको सारी medicines दी जाती है according to an embryo transfer. You have started with your progesterone. Now when you are supposed to undergo an embryo transfer, that is when, on an OPD basis, we take your endometrium and send it to a genetic lab for further testing. Now they would get a detailed study of all the proteins and the gene expressions and everything, so as to give you a receptivity window. Now they would not only tell us कि हमारा endometrium receptive है या नहीं है, they would give us an idea about when will it be receptive. So say for instance, I take the endometrial biopsy at 120 hours from the start of progesterone, and the report comes it is pre-receptive. Instead, you should be doing a transfer at 132 hours. So it gives me an idea of whether the endometrium is receptive or not, plus when would it be receptive. So that is the endometrial sample. Now, if I have to see the embryonic factors, कि हमने embryo का discuss किया. Now, the first thing is a frozen embryo transfer increases your chances of pregnancy, because if you are during the stimulation अगर आपके E2 levels काफी high हैं या premature rise of progesterone है, that is when your implantation potential will come down. So with a frozen embryo transfer, the chances of conception increase. Day 5 transfer. Now अगर आप देखोगे, the embryo is at various stages, या तो day 3 or cleavage stage or a day 5 transfer. So now internationally it is accepted that a blastocyst transfer जो है offers you the highest success rate. And it does not make a difference when you're saying कि हम 3 डालेंगे, at time like 1 डालेंगे, 2 डालेंगे, 3 डालेंगे, 4 डालेंगे. We at Oasis do a single embryo transfer. Mostly we do a single embryo transfer depending upon the patient's age, uterine status कि uterus का क्या status है, endometrium कैसा है. We can take a call for 2, but never more than 2, because if you think that is going to increase your chances of conception, that does not happen that way. So a single day 5 blastocyst transfer offers you a very good success rate if done properly. Then there is another laser assisted hatching. Now hatching is where हम बाहर से एम्ब्रियो को एक लेजर शॉट देके हेल्प इट कि वो बाहर निकल के हैच कर सके. Now it can be helpful when the zona is very thick. मतलब जो एम्ब्रियो है जो जिस कवरिंग के अंदर है, अगर वो कवरिंग बहुत थिक है, when आपका embryologist feels, now this is a decision that you cannot take outside. The clinician and the embryologist, your fertility doctor and your embryologist will sit and discuss it and decide whether this embryo needs it or not. But the facility should be there. We offer it at all our centers. The laser assisted hatching would increase the chances in cases of thick zona. And then there is something known as embryo glue as well, which has been introduced. Now, embryo glue is basically a hyaluronic acid, which is normally there at the time of implantation. We supplement it, and that having various studies, it has shown that it increases the chances of implantation. Now, what for the male factors? Now, we've discussed कि okay, maternal factors हो सकते हैं, embryological factors हो सकते हैं, and there can be male factors as well. Now, male factors there would be, what if the partner has diabetes, or is very obese, or there is something that is severely affecting the motility of the sperm, or the sperm quality seems compromised. Now, there would be, if the sperm parameters can be assessed with a DNA fragmentation index, that would give us about what is the status of the DNA content of the sperms. And higher the DFI, higher the chances of having a poor quality sperm, higher chances of miscarriages. So how do we counter this effect? So apart from the nutraceuticals that the male has, male factor one is you work on your health, and then we work in the lab. So your counterpart would be you take your antioxidants, start exercise, get your medical disease under control. If you're obese, get your weight loss, have frequent ejaculations. And in the lab, we can take care of it by advanced sperm preparation technique. Now, advanced sperm preparation techniques would be like microfluidics, MAX. Now, these help us select a better quality of sperm, and the blast conversion rate is significantly higher when advanced sperm preparation methods are used. So, having said all this, apart from like this is something that we as a fertility specialist would offer to you. Apart from these medical interventions, what we need to deal with is your health as well. Because we know that a failed IVF cycle brings a lot of despair and disappointment to one. So it is very, very important to take care of your emotional or mental health as well. So we at Oasis firmly believe that our patient is more than a patient to us. We, apart from offering a fertility treatment, we offer the emotional support and counseling as well, and that is what is needed when we are into a failed IVF cycle. So it is very important that you spend some time together, discuss it out, practice yoga, include exercise. Now, when we are taking this 4 to 6 weeks break before we resume again, with obviously it has to be with full vigor and optimism as well. So we need to heal ourselves physically and mentally. So for mentally, we need to practice yoga. Now that the yoga day is also yoga week is going on, everybody is going about it. So it actually helps you out, helps you keep you under control your anxiety and stress levels, which is stress actually on various international studies it has been shown to have a negative impact on your fertility. So when you practice yoga, you breathing exercises, you eat healthy, eat antioxidant rich food, take your supplements so that your health is taken care of, and include a little bit of exercises, say for instance around 30 minutes of exercise at least 5 days a week, or if it is vigorous it can be 60 minutes for 3 days as well. So this exercise for both the male and the female would help improve your outcome as well, improve the quality of the eggs. Now, the quality of the eggs per se would, like when we talk about the quality of the eggs, your response to medicines can actually improve when you have a little bit of weight loss, the injections and everything. The quality can be, you can be aided with certain injections, like we have growth hormones and all. And the male sperm factors, you know that new sperms are formed every 3 months. So if you get into a good lifestyle, good habits right now, leave, quit smoking, any other addictions like vaping or alcohol, excessive alcoholism or tobacco that has a negative impact. So quitting all the addictions, getting into an exercising regularly. If you're obese, marginal, at least a marginal 5% weight loss, and getting our medical comorbidities under check can significantly improve your results and your outcome. As we say, it is, we can have a, it's like bringing a new life into the world. So we need the seed to be good, we need it to be a good ambience atmosphere, and then we can plant it further and it can grow further. So we want that the seed to be good, we take care of our health, the ambient atmosphere, the uterus and the environment, that is taken care of by the advanced techniques, and then we can nurture it further so that we get a healthy pregnancy and outcome. And do not forget that failure is only the opportunity to begin again, only this time more wisely. Hence, we at Oasis, we believe that with the advancements of newer techniques, the international standards should be offered to everyone so that we can help you get achieve your dream of parenthood. Thank you. If you have any questions, please let me know. I actually did not discuss the embryo genetics. Now, the embryo genetics, I have to tell you that we can assess the genetics of the embryo with the help of a pre-implantation genetic testing. When we have a day 5 embryo that is ready and we've had recurrent implantation failures, the embryo can be assessed for its genetic components, for the aneuploidies, or if there is any specific genetic defect which can be inherited from the parents. Now, when there is advanced stage, say for instance beyond 38, this pre-implantation genetic testing actually helps us get a euploid embryo. Euploid embryo, one which has the normal genetic chromosome number, which increases the chances of conception and more importantly increases the chances of getting a normal, healthy live pregnancy. Any questions? I think with this we can conclude. How do I move on after failed IVF? So, after a failed IVF, it is very important that we move on both physically and emotionally. So, physically is by having giving yourself a break of 4 to 6 weeks, eating well. Now, emotionally would be you getting support from your friends, family, and even your doctor, and practicing yoga, any mental relaxation techniques like mindfulness, and discuss at the same time. This 4 to 6 weeks period can be used to actually find out what went wrong, why did it go wrong, and to fix it with the help of your doctor. So ideally you should have a break of around 4 to 6 weeks after a failed IVF cycle. This absolutely depends upon you and the treating doctor who decides how much break do you need, but minimum 4 to 6 weeks should help you recover from um, your physical and emotional processes. How many months after failed IVF can I try again? See, if there has been a failed embryo transfer, 4 to 6 weeks. If it is somewhere else, like the number of eggs was low or the embryos did not form, that would be a totally personalized work. If you were working on the sperm parameters, that takes 3 to 4 months. If you're working on the number of eggs, we can go for a dual stimulation. Can we try naturally after failed IVF? Yes, you can absolutely try naturally, but it all depends upon what was the reason for having an IVF in the first place. So if it was for a blocked tube, the natural conception is not going to help you out. If it was for unexplained infertility, yes, you can definitely try. And actually, nobody is stopping you from that. You can actually take the help, and we can actually give you supplements to boost your natural fertility, and you can give it a shot. Ah, I think that answers all the queries. If you have any query regarding failed IVF cycles, how to proceed further, please feel free to contact us on the given helpline number, or you can reach us out directly at Oasis Fertility Vadodara. Thank you so much.